As a healthcare professional, I'm very keen to ensure that all of my patients with diabetes have a foot examination on a yearly basis.
You will be asked as part of your annual foot check to remove your shoes and socks. We will examine your feet in between your toes, the whole of your feet, looking at the circulation, looking at the temperature of both feet. We would then check the pulses, check that they are present in both feet, and we would also use a very small wire called a monofilament to assess your nerve endings. We would look at the general condition of your feet to ensure that there's no cracks, ulcers developing.
My annual foot check is usually it takes place in the GP surgery, and it's the diabetes nurse who actually does it.
She checks the pulse rates on my feet, making sure the blood flow into my feet is being maintained at a proper level.
The bit I hate is where they do the base of the foot to see if you can feel everything, as it tickles like mad. But yeah, looking at those sort of things. And she will also check out my HbA1c, blood pressure, weight, etc. So it's like a full review.
At the end of the foot check, I would recommend that you keep your diabetes well under control, that you attend for regular monitoring to ensure that your feet are in the best position to be well looked after. I would advise you that you would check your feet regularly yourself. So when you're having a bath or a shower, make sure they're dried properly. Check the in between your toes to look for any signs of any damage, and report any damage to your nurse straight away. Also ensure that your footwear is good fitted, well fitted foot, that you have them measured regularly. And that they're not squeezed into tight-fitting shoes that may cause damage to the feet. There are 3 risk levels with regard to the diabetic foot. Low risk assesses that there are no issues at all. The sensation and the pulse circulation is absolutely fine. That's repeated on an annual basis. Moderate risk indicates that there may be a loss of sensation in one or both feet and may mean that you're at slightly increased risk of developing an ulcer. You may be referred to the diabetic foot screener and given further advice, written literature on how to look after your feet. A high risk may indicate that there is loss of sensation, an ulcer present, or loss of pulse in circulation. For that particular risk area, you would be immediately referred to a diabetic foot screener for them to further manage and monitor your feet.